Hello, my name is Morgan Carmen. I'm the class of 2021 in the School for Public and International Affairs. And this summer, the Center for Health and Well-Being funded a virtual internship of mine with Professor Noreen Goldman, working on a project about COVID-19 demography and epidemiology. And so it was understanding cross-national differences in COVID-19 mortality among the elderly. So this project was essentially first inspired by the fact that different countries appeared to present different mortality rates for their elderly populations, different mortality rates proportionally. And so you can see the graph that we were originally working off of in the reflection section of this poster. It was created by Fumiya, who was the grad student with whom we worked. And as you could see in the graph, different countries exhibited very, very different rates of mortality within their elderly populations. So we decided to investigate these international discrepancies. And I originally applied for this internship because I wanted to contribute to the knowledge that was growing every single day on the COVID-19 epidemic, because as it was starting out in the first few months, and even now, we don't know enough about it. We don't know enough about how it affects different populations. And so when I saw that I could have an opportunity to look into how it was going to affect the elderly, a very vulnerable age group, I jumped at that chance. And I'm very grateful that I did. So what I was doing mostly was looking into these disparities from a place of trying to conduct a literature review. So I was looking into why there might be discrepancies. So I was looking into nursing homes, the way that elderly are cared for in different populations, the age structure in different countries, how top heavy is a given population. A lot of what I found was that nursing home conditions are very similar in most countries, though in different countries we were seeing a disproportionate share, higher or lower disproportionate share of deaths happening in nursing homes. For instance, in Canada, approximately 81% of deaths from COVID happened in nursing homes, whereas that was about 40% for the United States. And then beyond that, once we realized that nursing home conditions were pretty similar in most countries, I looked into the relationships between over 65 and younger than 65 age groups, because we were looking into relative excess mortality as well, which means that we were comparing the mortality outcomes for people over 65 as compared to people under 65. And we originally did this to control for the varying prevalence of COVID in different countries, because we were comparing several. But what we found was that different countries had differing levels of spikes in excess mortality during the pandemic, which means that during periods of time throughout these past several months, it became increasingly dangerous to be over 65 in a variety of countries. In the United States, we didn't see this spike at all. So I was also in charge of looking into why that might be, looking into why middle-aged adults, older adults might be more likely in the United States to die from COVID than somebody around that age in another country. And so this was a virtual internship. We would meet on Zoom once a week, and we mostly communicate through email. But I still learned so much about the basics of epidemiology and demography and how to compare populations, what excess mortality is, what relative mortality is, how to measure death rates, why our measures at the beginning of this pandemic were so misleading, why differences in testing were so misleading. And so that was overall incredibly exciting to learn so much about what was happening, this global health emergency that was making my internship virtual, learning about it, adding to knowledge about it. And once again, as I mentioned before, this graph is what motivated our research, and we mostly focus on excess mortality rates. The figure originally, as it does here, represented reported deaths from these countries. So it was based on the testing regimens that these countries were using. They would report the number of people who died in a given age group. But because of discrepancies in testing, because of a lack of testing, because of all of the confusion and upheaval caused by the pandemic, countries were measuring deaths differently, which is why we ended up looking at excess mortality during this period. And then to look ahead, I do see myself continuing to look into demographic and epidemiological analyses of social inequity, because this one was incredibly fascinating, and it really had to do with the way that we treat our elderly, the way that we foster an unhealthy environment for certain age groups and certain demographic groups. And so I found that perspective, which was new to me, to be really exciting. So I would like to continue with that sort of work. And then the questions that sort of arose from this investigation, for me at least, were policy level questions. So how can we better care for our elderly populations so that when health emergencies strike, they're protected? And how can we in the US improve outcomes for the middle age? Because as I said before, we didn't see that spike in relative mortality. And so what I took from this summer was that understanding cross-national differences is incredibly instructive for identifying where we go wrong, like in the United States, where it likely became more dangerous to be middle-aged than in any other country during this period of time. And then also what we can do better. So looking into what other countries have been doing to produce these different health outcomes. And so I would like to thank the Center for Health and Wellbeing for providing me with the funding and the support to be able to do this summer under these different circumstances. And I would also like to thank Professor Goldman and Fumea for being so generous with their knowledge and so willing to teach, and so receptive to all of the very many questions I had about this field that was very new to me. So overall, I had a fantastic summer. So thank you so much.